Hello, my name is Jennifer Butts, MSN Education Candidate. Today I will be presenting my evidence-based education innovation project, Discharge Teaching Process to Reduce Readmissions for Heart Failure. The evidence-based education innovation was developed based on the learning needs of senior associate degree nursing students to effectively use TeachBack to reduce 30-day readmission rates of heart failure patients. A gap analysis was conducted with the nursing students based on the needs of the unit. They were asked if they were participating in discharge teaching and what they knew about heart failure readmission rates. On this nursing unit, where the students have been practicing, most of the heart failure patients are seen by a heart failure case manager, so they are not getting exposed to much of the discharge teaching process. Heart failure is identified by the Centers for Medicare and Medicaid Services, CMS, as one of the conditions that affects large numbers of people with Medicare and is included in the Hospital Readmission Reduction Program established in 2012 as part of the Affordable Care Act. CMS has assigned financial incentives as well as penalties to hospitals' percentage of 30-day readmissions for heart failure. The Hospital Readmission Reduction Program supports the national goal of improving health care for Americans by linking payment to the quality of hospital care. TeachBack is a technique for healthcare providers to ensure that they have explained medical information clearly so that patients and their families understand what is communicated to them. TeachBack helps identify gaps in knowledge, allowing the nurse to build on baseline knowledge. It has been recommended by the Agency for Healthcare Research and Quality, AHRQ, and the Institute for Healthcare Improvement, the IHI, as a strategy for taking universal precautions for health literacy. The education innovation is taking place with 5 associate degree nursing students that are completing a clinical rotation on a medical surgical telemetry floor in an acute care hospital. These students are preparing to graduate, and this is their last clinical rotation. Due to the current circumstances with the COVID-19 virus pandemic, all of the instruction time will be conducted through an online classroom forum. In this case, I will be using Google Classroom to facilitate the online module. The curriculum will consist of a pre and post test with heart failure questions and TeachBack questions, a PowerPoint presentation, and with general heart failure questions, general heart failure information, background on the Affordable Care Act and CMS, TeachBack information, and resources for providing patients with education related to heart failure. 2 video demonstrations of TeachBack specific to heart failure are provided, which will be followed up by a discussion board post requiring the students to provide 4 examples of questions that can be used with TeachBack related to heart failure, discharge teaching, and potential barriers to using this practice. This will replace the role play scenario, which was originally planned to be done in person. The students will also be asked to participate in the discussion board by responding to their peers' posts and making 1 suggestion related to their peers' posting. Online education provides a unique set of challenges compared to face-to-face education, especially with respect to clinical instruction. Although I will have to modify part of my curriculum to better fit the needs of the online education, the nursing learning theories remain the same. The guiding learning theory and pedagogical approaches are constructivism and social cognitive theory. Constructivism and social cognitive theory work together to achieve learning outcomes that promote active learning as well as modeled behavior. Constructivism focuses on structuring learning scenarios where the student is actively involved with education material and social interactions. The discussion board assignment will be based on problem-based learning. In this activity, the students will use a scenario provided to them to construct their own questions based on the principles of Teach Back. The student will actively engage with their peers by providing constructive feedback to their discussions. Social cognitive learning includes teaching new behaviors and skills while encouraging and persuading previously learned behaviors through observation. Social cognitive learning can be done vicariously, using videos modeling the expected behavior. This theory incorporates well into an online curriculum where much of the learning and activity that is taking place is done through observation and virtual technology. The learning objectives for this education innovation are: upon completion of the education model, the students will be able to recall the importance of using Teach Back for heart failure discharge teaching, demonstrate understanding of Teach Back principles by creating 4 questions for discharge teaching specific to heart failure, provide constructive feedback to their peers' discussion posts that demonstrates knowledge of the Teach Back process for heart failure. The intended outcome for the education innovation is to provide the student nurse with the tools to effectively use the evidence-based Teach Back tool to assess patient learning needs and provide discharge education for heart failure tailored to the patient and/or caregiver's learning needs. The assessment of the effectiveness of the innovation is based on the results of a pre- and post-test and a discussion board after watching video demonstration of the Teach Back method. The pre-test identifies what students have already mastered. A positive change from the pre-test to the post-test is then considered as demonstrating the effectiveness of the intervention or as simply an improvement. Qualtrics will be used to design the survey questionnaire and evaluate the effectiveness of the innovation, including assessing if the education innovation provides valid and reliable data. Qualtrics is what's used to design the pre- and post-test. A rubric for guiding the students in the online discussion will be used to determine if they have mastered the content and could apply it to direct patient care. A survey at the conclusion of the module for the students to complete will be used to evaluate the education module and provide constructive feedback for assessment of my teaching practice. Thank you.